with Dr. Vivek Lal, the Director of the Postgraduate Institute of Medical Education and Research, PGI, MER, or PGI as is popularly known, as all of North India, not just all of North India, but perhaps all of India knows this institute. An institute that's synonymous with excellence, with hard work, with the best of the best, the creme de la creme. Everyone comes to PGI. And Dr. Lal, who is not just director of the institute, he's also the dean of the neurology, the head of the neurology department. And we are very lucky at the Tribune to have him here in our studios. I'm Jyoti Malhotra. Dr. Lal, thank you so much for coming to the Tribune.
It's a pleasure to be with you, ma'am. And at the very outset, I would like to thank your group of papers who have been exemplary in their support for PGI. You have been, publishing supplements on PGI at every convocation day as far as I can remember. And I'm so grateful to the Tribune.
Thank you so much. It's very kind of you, Doctor. And, with your support, and well, you are the best. So I guess to institutions with a legacy like ours. But my question to you is, or my first question to you is that we are at the end of 2024. It's been a tough year. It's been actually the last few years since COVID have been really tough. PGI itself has gone through a lot. You've had a few strikes this year. But my question to you is, how have you coped with, say, COVID? How has the Institute coped?
See, let's put it straight. I think COVID brought a nation together.
Yes.
Like no other event I know of.
Mm-hmm. So you needed a pandemic to bring India together?
No. This was unique in every possible way. Not only did our nation come together, India led from the front. And our medical fraternity, our entire government machinery worked in an unprecedented and exemplary manner to get things rolling and moving. Mm-hmm. And we literally won the battle against COVID solely by our commitment and devotion. Don't forget, compared to the West, we have a skeletal infrastructure.
Right.
And the West literally had a bloodbath. Whereas
India did not have a bloodbath?
No, nowhere compared to the West, compared to the infrastructure that they have.
Okay.
You've got to look at the infrastructure. Mm-hmm. They are valuing in luxury. Not so in India. But we, with our vaccine ethos, with our, you saw how every Indian wanted to be vaccinated.
Absolutely.
No one, we just said we've got to do it for the country.
So what about post-COVID complications? There have been a lot. I mean, sometimes I feel, when your heart beats faster, you wonder if it's a post-COVID thing or whether it's, something else that's going on. So how is a patient supposed to know what's going on?
I am very happy at that tough and pertinent question. Mm-hmm. Let's look at data in patients who were not vaccinated.
Right.
The death rate, the morbidity was sky high.
Much higher.
Much higher. Much higher, monstrously higher as compared to those who were vaccinated. So let me give you an example. I got the vaccine 8 times, twice in the trial. Then let's put it straight. Twice in the trial. Why did I get it in the trial? Because everyone was scared. So I said the best thing to do is lead from the front.
Right.
So I was amongst the first to be vaccinated.
So you're a guinea pig, Dr. Lal.
So don't use that phrase. Okay. I was for a good cause.
All right. Okay.
For a good cause. Okay. And I said, okay, I'll lead from the front. Me and my wife, we got ourselves vaccinated. And subsequently came the vaccine. First it was a trial, then the vaccine by the government of India, and then the booster.
Right.
So I got all 8 shots.
Okay.
And there I am. But yes, there would have been some I'm not denying that. But then you have to look at what happened to those who were not vaccinated. The answer is in the West. The bloodbath was in the West, in Europe, right? I'm not saying it didn't take place in India, but compared to the West, our mortality, our morbidity was far less because of the vaccine.
Because of the vaccine.
Because of the vaccine.
Full credit to the vaccine.
100%.
So both the vaccines, the India-made vaccine as well as the vaccines that we imported.
The India-made vaccine proved its mettle when it was exported to surrounding countries also, and it proved its mettle there also. So
now what about post-COVID complications? Heart disease, lung disease. What would you attribute that to?
I think it's part COVID.
Okay.
Sure. Something called prolonged COVID. That's right.
Yeah.
There's no doubt about that. Part vaccine. But certainly we are coming to terms with these post-COVID complications. They are now on the decline. But
Naturally, are they naturally on the decline?
One. Number two, the sad thing is, because there was COVID, everything is attributed to COVID. That's also unfair.
That's true.
That's unfair.
So how is a patient like me supposed to distinguish between, something that may have happened because of COVID or naturally?
Very relevant question. Reference to the data.
So I should come to a doctor at PGI, of course.
Not at PGI, anywhere you feel comfortable. Okay. And then when you integrate everything, you look at everything, you realize whether it is post-COVID or whether it is vaccine-induced or whether it is unrelated to either vaccine or post-COVID.
Now tell me, as a patient, if I come to PGI, will I be treated? If I walk in through the doors? I've never been to PGI, by the way, so I'm perhaps one of those very, very few people living in Chandigarh who still, I don't want a doctor, Dr. Lal. But if you walk into PGI, will everybody be treated?
So PGI was founded in 1963. With the passage of time, the footfall has gone through the roof.
How many patients do you have?
Last year, it was 30 lakhs.
Last year being 2023?
Yeah, 2023. 30 lakh patients came to PGI. It comes to approximately 10 to 15,000 OPD patients in a day. And approximately 1 lakh surgeries are done.
Every day?
Yes, every year.
Every year.
You get my point?
Yes, of course.
So, if 30 lakh patients are walking into PGI, they have faith in PGI. No one just walks in. PGI is not advertising itself.
No, you're not.
It's our patients who are advertising PGI to others. And why? Because of the fears. It's important, and I'm making a statement here. Our commitment, our devotion is unmatched. That is what keeps us going.
Unmatched with the private hospitals that have sprung up. There's nothing wrong with private hospitals, doctor.
There is a colossal difference between PGI and other private hospitals.
Okay.
Let us be very honest. We are not in a business. We are in a service. Others, whatever they might say, have a business too. They have a domain of business to operate in.
Okay.
Their ecosystem is separate. Our ecosystem is totally separate. And that is why not only do patients who come to PGI and are being treated in PGI come to PGI, there are those who are in private hospitals who are coming to PGI for a second opinion. Dime and dozen.
But doctor, can I just say that the reason you have private hospitals is because the public health network in your state or in Punjab or Haryana or across North India has failed. You don't have a public health network. You're supposed to have one, but you don't.
Partly true. Private hospitals are there to help.
So they fill in that gap?
Yeah, they fill in that the vacuum.
Yes,
that's right.
Absolutely.
Yeah, that's right.
So you should have one?
Yeah, sure. Oh, yeah, sure. When I was saying no.
Okay.
In the West, in the United States, everything is private. You have the VA hospitals, they're government hospitals, but majority is private.
Right.
You just saw that killing of a CEO there in USA, which actually threw the spotlight and just how horrible their insurance system is.
Yes.
And you know what happened?
Yes.
Everyone is siding with the file who shot the person, not with the person who was shot.
Who's been shot. Yeah.
So, now you compare their system with our system, we are miles ahead. We are miles better.
What are you miles ahead about?
In terms of patient care, in terms of the cost of patient care, in terms of our commitment and our accessibility to doctors.
Dr. Lal, if you walk into a primary health center in a village in Punjab, I'm sorry, or forget about a village in Punjab, if you go to the big cities, Amritsar, Ludhiana, Jalandhar, where the Tribune has its centers, you will not find doctors in the hospitals who should be there.
Yeah.
I'm not saying that you or PGI are responsible.
Yeah.
But you are a doctor of standing.
Yes.
What do you have to say about that?
You see, I think that needs to be looked into very seriously by the concerned authorities. But when it comes to PGI, I give you an example. I often say, PGI works 24/7, 365 days a year, and it is like T3, Terminal 3 of the airport, IGI airport. It never sleeps.
Right.
And you will never see a patient or a doctor yawning in PGI. You come at midnight. You said you've not come as a patient. Come as a journalist, come incognito, and tell me if you get to see a healthcare professional who is found wanting in his duty. We do far beyond what is expected.
So then why are your resident doctors going on strike?
Because of two reasons. A, there was this sad incident
In Kolkata.
In Kolkata.
Yeah, where the
entire
young girl was
nation's conscience
brutally
was stirred.
raped and
And
tortured.
if
Yes.
you know that Honorable Justice D.Y. Chandrachud also took the name of PGI and my name in the Supreme Court with a sense of pride
Yeah.
and honor. Secondly, the reason why the residents go on strike, in the past, no resident doctor has gone on strike for any other reason, was for lack of amenities. But now those amenities are gradually being fulfilled.
Have they been?
Yes, more or less.
Okay.
Yeah.
So you can assure the resident doctors of PGI that their concerns are being taken care of. Because you did warn them, by the way. Okay, first you answer your question and then I'll ask you.
You're a clever journalist. The last 2 years, the resident doctors have got more than what they got in the previous 10 years. These statements are coming from resident doctors themselves. So things are moving in their favor, fast in their favor. We have got now mentors. We are looking at our resident doctors as part of us.
So were you upset when they went on strike earlier this year in October? A few months ago.
No, I wasn't.
No, in PGI, when resident doctors went on strike a few months ago, were you upset?
No.
Why not?
Because the cause was right.
Because of the RG car brutal rape and torture.
It's a blot on the conscience of the nation.
What happened in Kolkata?
Yes, it's a blot on the conscience of the nation. We as a nation are known to have had universities like Nalanda and Takshila. We are a nation very strong spiritually. It's a shame that something like that happened. I made that statement. I say that statement on record again.
So you were empathetic to your fellow doctors, much younger colleagues, the resident doctors who went on strike in support of their colleague in Kolkata, yes?
Do you know something? Not only was I empathetic, doctors were empathetic and patients also were empathetic.
But patients were deeply upset.
Yes, they were.
Because this went on and on for many days.
But then the Supreme Court, the Honorable Supreme Court intervened.
Stepped in, yes.
And stepped in.
But then you did say also that there would be no work, no pay if the resident doctors didn't go back. You did say that.
Yes.
Why?
Because the resident... No, I didn't say that. The Honorable Supreme Court exonerated that time period of strike. Very tough question. But the Honorable Supreme Court, they got their due. They got their due because the Honorable Supreme Court said this period of strike, they gave a date also, is to be exonerated, and it was exonerated. It has been pronto. No issues on that.
But you did have to make that statement, no work, no pay, which means you were upset at some point.
I didn't make that statement. Someone else would have.
Well, PGI made that statement.
No. That was made the second time. When there was no reason for them to go on strike for a day.
That's the point I'm asking about, not the RG car support. Yeah. Again, when the doctors went on strike, the younger doctors, you did make the statement, no work, no pay, that you jolly well get back to work.
Yes, and they did. And so that was because it was a contempt of the Supreme Court. The Supreme Court...
So you were upset?
The second time, yes.
So therefore you didn't understand why the resident doctors were going on strike again and again.
Yes, that's right. The second time, that's right. Not the first time.
So this spirit of service that you talk about, were you deeply upset that your resident doctors
I was terribly upset the second time.
Why?
As a man who leads from the front, I was terribly upset because there was already a strike in PGI and the resident doctors were called by my entire team. And yet, they were wrongly led by their big honchos. And they went on strike. Not only did they go on strike, they also were trying to get others to go on strike. It didn't happen and they came back in 24 hours.
Who are the big honchos?
The group, the ARD group. But that's relevant. That's irrelevant.
Okay.
The important thing is not me, everyone was. You cannot commit the Supreme Court has stepped in. Once the Honorable Supreme Court is apprised of this matter, when the other doctors didn't go on strike, in PGI, a strike has no meaning. PGI dham hai. Understand? There was no
PGI dham hai?
Yes, it is.
Kaise?
Dham hai. जहाँ पे मरीज आता है ठीक होके जाता है तो धाम है ना धाम ही है ना It's a big dham. I call it a big dham. There will never be another PGI again in India, I'm telling you. ये बना 1963 में, the founding fathers, I'm making a statement, had a strong divine vision. They created PGI out of nothing and they gave everything that they have to PGI. We are living in their legacy. We are living in their legacy. We are breathing because of them. Our patients are breathing because of them. Without that, without the founding fathers, this kind of an institute would probably not have been born. Ours is the only institute in India, Jyoti ji. So PGI transmits its morning classes across the world.
Sir, All India Institute भी करता है sir?
I don't know. If it does, I'm glad. But I do know about PGI. It's one of the only institutes in the country which transmits to more than 150 centers in India and across continents also. To Australia, our YouTube channel transmits our morning sessions.
So what is the point you're making? That PGI is special?
Yes, oh, it is. Oh, yes. Yes, ma'am. It is special because of the devotion, because of the commitment of our healthcare workers. It is special.
But
yes.
Can I just say that aapko, it's like a jewel in a forest, perhaps, or in a dark room, but you haven't been able to, what is your legacy is the patients that go back healed.
Yes.
Right?
Yes.
But what about, why is there not another PGI? Why are you the victim of your own success?
We are victims of our own success because when we succeed, it increases the faith of people in PGI.
Sir, मैं आपसे ये पूछ रही हूँ कि एक पंजाब में, एक North India में, there is one PGI.
Yes.
Why are there not 10 PGIs?
Because of the simple reason that to make 10 PGIs, you need to have the same commitment and devotion which is there in PGI. When I was studying in Amritsar Medical College, I'm talking in the year 1981 to 86, I struggled and then I came to PGI.
Why did you struggle?
Because they did not have that gravitas which PGI consultants.
What was different?
The commitment and devotion.
Okay.
Oh, the commitment and devotion in PGI. Why do you think I was annoyed when the second time these boys and girls went on strike? Because it is an antithesis of commitment and devotion.
What does that mean when you say that in Amritsar Medical College, the commitment and devotion was less than what you saw in PGI? What did that mean?
Oh, well, you see, as you yourself said, that when you come to PGI, it was like all 24/7, work was worship, work was life, life was work. That was...
And that was not true for Amritsar Medical College?
I doubt whether it is true for any college. I repeat this
what
statement.
What was the difference? What did doctors not do?
The duty. The duty.
Meaning?
The duty. PGI, they
did not come to work on time?
Yes, probably. I left in time. I came here.
No, but when you're saying they did not come to work on time, what was it? Did they not attend to their patients? What was it that upset you so much?
What upset me was the system there. The system here is far more patient-friendly than it is in other parts of India. It is patient-friendly. Why do you think 30 lakh patients come to PGI? There must be something in PGI. They come. There has never been a gunshot fight. There has never been a slugfest.
Never.
They come. That is why
never gunshot fight?
Never. That is the reason every doctor's day, when I give an interview, I dedicate it to my patients because my patients are my strength and they are continuing to come. Now we have opened Sangrur. We are on a track. We are opening Una. We should have Firozpur. We are having satellite centers, which is what PGI is all about, radiating medical knowledge and medical care. And you just said one thing. You said, Vivek, in terms of patients, right? PGI has got a lot to boast of. Not only patients. In terms of research, we are the number one institute in the world. In India, in India.
Okay.
We are the number one institute in India.
Right.
In terms of producing teachers, in terms of producing students and doctors, whenever a patient comes to a doctor and sees the tag PGI written next to that doctor, his confidence automatically increases in that doctor.
But not so for Amritsar Medical College or Ludhiana Medical College or Jalandhar if there are medical colleges across the state.
For that you would ask a patient, probably the answer is yes. It's only when you have a post tag PGI written against a doctor that the confidence of a patient goes up in that.
So then, if I'm living in Amritsar and I cannot afford to come to Chandigarh, or if I'm living in some pind in Taran Taran or Abohar or Fazilka,
yes,
then my own system has failed me.
You see, for that you'll have to talk to the Punjab government.
No, but you're a doctor, Dr. Lal.
Yes, yeah.
So you tell me as a doctor, why can I not get that quality of of medical treatment in Abohar or Fazilka or in Taran Taran?
There are two reasons. Very good. Thank you so much for introducing PGI. Crème Meta Crème have come to PGI.
Yes.
They are fiercely devoted and committed. That devotion and commitment, पांचों उंगलियां बराबर नहीं होती हाथ की. पांचों उंगलियां बराबर
So
नहीं
would
होती.
you be willing to work to improve the public health infrastructure across the state, not just in Punjab, in Haryana, in Himachal,
We are doing
Jammu
it
and
across the
Kashmir?
nation by sending the right kind of doctors across. Those who pass out of PGI, every year 1,000 residents leave PGIs.
No, but
portal.
would you be willing to work with the government to improve the public health infrastructure?
Gladly, we do that. Our Department of Public Medicine, we have got Raipur Raini, we have got other surrounding areas where our doctors go to.
So what is wrong with PGI? Tell me that. You've been here forever.
What is wrong with PGI? Very good question. We need more manpower because
More doctors.
More doctors, manpower.
Okay.
Not only doctors.
Why can't you get more doctors? There's a doctor's dime a dozen. The private hospitals are flush with good doctors.
We need residents, we need nurses, we need technicians, we need proper healthcare professionals. So, whenever we have got sanction, we get them. But the faith in patients has gone through the roof in PGI.
Okay.
And that's the reason.
No, so why can't you get them? When you say you need residents, you need nurses, you need a variety of
So
other...
we are knocking at the doors of Delhi, and I think we should be having a sea change in the number of healthcare professionals by the next year end.
A whole year from now.
Yeah. We're going to have interviews this year. We're going to get more residents. We're going to get more technicians. We're going to get more nurses. Things like that.
So, are you saying that you don't pay enough, and therefore people are not coming to you?
That's a very relevant question.
Do you not pay enough?
It's a very relevant question.
Yeah.
That's a question that needs to be asked by those people to themselves. I'm no one to say whether we don't pay enough. I'm not paying.
How do you compare the salaries at PGI with those of private hospitals like Fortis or Max or all the others?
So let me be honest. I'm a poor cousin of those who are in private hospitals.
Okay.
I'm a very distant poor cousin.
Okay. Like 1/10 the salary.
Yeah. Okay.
Or more.
But it all depends upon how you define poverty. Am I clear? It all depends upon how you define poverty. I'm happy to be where I am. And there are many in PGI who are happy to be where they are. No one is keeping them back in PGI. They're staying back on their own and they're doing their duty with conviction, with dedication and devotion. But yes, there is a colossal hiatus between the private sector and PGI. There is not PGI alone. It's other INIs and other, private institutions. There is a colossal hiatus.
So you would not sell your soul to the...
You are a tough journalist.
No, you would not sell your soul to the devil, even if he comes in the disguise of a doctor.
Well, you see, you have to understand one thing. There are two important things. Society is going down a cliff today. Values are at a discount. When PGI was made by the founding fathers, they only had devotion and dedication in mind. Today, there are many other ancillary considerations.
Like what?
Money.
Okay. What does that mean?
Everyone wants to be as rich as Croesus did. The Greek fellow who was as rich, that
Kuber.
phrase. Yeah, Kuber, right? So it's some people are like that. All the 5 fingers are not the same. So
no, there's nothing wrong with wanting to be rich.
I
and
am
wealthy.
not for a moment.
The question is not about whether doctors want to be wealthy. The question is if you are falling short of the service that you're supposed to provide.
Well said. That's
for
if
you're doing your good job, you can be paid whatever you want.
Yes.
What the market demands.
Yes.
So there is a market for your...
there is a market.
But the question I'm asking to you is, why is it that there is the public health infrastructure in North India sucks? Why?
I think there are 2 reasons for that. A, the public health system in North India sucks. Let me tell you 2 things. Because A, it's becoming commercialized, badly commercialized, something which PGI has not been affected so far.
But it's becoming commercialized because the private sector is coming up, because the public health sector has not kept pace.
Yes.
And you have not kept pace because
I am here as director of PGI.
Do you think there is collusion?
Hold
I'm
on.
asking you. Is there collusion in the health sector?
I've got your question.
Okay.
That's for you to ask them.
No, I'm asking you. You've been in the business for so long.
I'm not in the business. I'm in PGI. I've been in PGI for 35 years.
Okay, that's a fair point.
You get my point? I'm in PGI for 35 years. In PGI, there is no collusion. That's for sure. That is why.
No, my concern is really that you are a victim of your success.
Yes.
That PGI is a symbol of dedication, hard work, of excellence.
Yes.
Not just dedication and hard work. A lot of people can be dedicated and working hard. But you are a symbol of excellence.
Yes.
Why is there, like I asked before, not 20 PGIs in North India?
There are 28 INIs now all across India. Institutes of National Importance, 28 aims have come up.
Right.
Right? And so they are like PGI only. You see, PGI...
So you think the model works?
I make a statement here. When PGI and AIIMS Delhi were midwifed, things were different. Today, a doctor wants to do his degree and wants to settle fast in life. For settling fast in life, few would decide to stay back in academics, others would probably go into the private sector.
But it's not as if the government is not paying enough. Are government doctors being paid enough?
You see, if you ask me, I'll say more than enough. If you ask me
more than enough.
If you ask me, as I said, it all depends upon how you define poverty.
Right.
I feel we are being paid more than enough. I put it that way. But yes, there is a gap. So a neurologist of my stature abroad will, outside PGI will be earning at least 10 times more, which is fine. I mean, that's okay. So I stayed back 35 years. No one held my arms and said, stay back in PGI. Out of joy, the joy of helping the man on the street.
So would PGI doctors go to the Pind, to the villages of Punjab and Haryana and
understand one thing, we are opening satellite centers. So wo Pindachi khul rahe hai. In Sangrur, in Una and in Firozpur. So we are sending our doctors there. Sangrur is now functioning. We have started many things quietly. We started dialysis in Sangrur. You understand? And we are doing routine surgeries in Sangrur.
Right.
So we are doing it.
And you have an advanced cardiac center.
Yes, we have an advanced.
What's the status of that?
It's doing very well.
Is it?
It's exceptionally well. All our advanced centers, advanced cardiac center, advanced eye center, advanced psychiatry center, they are doing exceptionally well. And now there are 2 more centers which are coming, the maternal and child health center and the neuroscience center. So we are doing well. You see,
a lot of these questions are from my colleagues.
I can make out, which is fine. And I'm glad you never told me those questions, which should be an impromptu, it should be an extempore interview.
And you have a poor patient fund.
Yes, we do.
How is that doing?
It's doing fine.
Is it?
It's actually doing fine. It's doing very well. We don't make noise about that because we are a government setup. So we do very well.
But people are donating money?
They are. I am lucky to be blessed by philanthropists who actually donate a lot of money. And it keeps rolling. The money is not just there gathering credit. It is being used for poor patients.
And there is a 100-seat MBBS hospital which is being proposed to be started at the Saranpur satellite.
Yes, in Saranpur. That's right. Yes. Okay. So God has been kind. We've just been given 50 acres land by the government. And the present health minister was instrumental in getting us that land, Mr. JP Nadda. I'm thankful. And now I think it was his dream that he wanted MBBS in PGI. And I think we should see that soon. But that's okay. But besides that, we're opening a trauma center. We're opening a OPD. We are going to have emergency there. And we are going to have we plan to have an advanced cancer center also there. Yes.
So this cancer, you spoke of cancer.
Yeah.
Now, I have 2 questions to that.
Yeah.
Why is the incidence of cancer increasing so much across the country?
2 reasons. I said society is going down a cliff. Addictions are on the rise. Undesirable, habits like smoking, drinking are on the rise. And above all, the use of insecticides in food is on the rise. So all the 3 in tandem have made cancer go through the roof.
Insecticide, you mean when you spray?
Yeah.
On the crop?
Yeah.
When you spray, whether it's DDT or
Yeah. That's right. Yeah.
So that should not happen.
That should not happen.
And it's because of that cancer is on the rise.
Oh, yes, that's right. Insecticides have a major role to play.
So why
they're chemicals.
So why don't doctors say this to farmers. Why don't you explain to the farmers
The
Tribune?
public
Would you like to
health,
say it in Punjabi?
ਮੇਰਾ ਇਹ ਰਿਕੁਐਸਟ ਹੈ ਕਿ ਜਿਹੜੀ ਤੁਸੀਂ ਇਨਸੈਕਟੀਸਾਈਡ ਸਪਰੇ ਕਰਦੇ ਹੋ ਆਪਣੇ ਕ੍ਰੌਪਸ ਤੇ, ਉਹ ਯਾਦ ਰੱਖੋ ਮਿਨੀਮਮ ਸਪਰੇ ਕਰਨਾ ਹੁੰਦਾ ਹੈ, ਕਿਉਂਕਿ ਉਹਦੇ ਨਾਲ ਅੱਗੇ ਚੱਲ ਕੇ ਕੈਂਸਰ ਹੋ ਸਕਦਾ ਹੈ।
ਹੈਗਾ ਡਾਇਰੈਕਟ ਰਿਲੇਸ਼ਨਸ਼ਿਪ ਬਿਟਵੀਨ insecticide ਤੇ ਕੀ spray ਕਰਦੇ
It is a chemical, and chemicals are known to foment cancer, ignite cancer cells in the body. Oh yes, yeah, that's right. So you see, you have to look at two things. Addictions are on the rise.
What is PGI doing about the drug, the drug habit in Punjab?
I am very happy that you have asked a question which I knew was coming, considering the power of your questions. We are running a drug de-addiction clinic. We are counseling the families. You see, when does a child become an addict? It just doesn't go and buy things from the market.
Sure.
There is something in the family that pushes him in that direction. Often, they are products of broken families. You see fentanyl deaths in USA.
Sir, there are 10 lakh addicts in Punjab. That's the assembly, the Punjab Assembly answer.
Yes.
Are you saying that 10 lakh families in Punjab are broken families?
I am not saying there are 10 lakh broken families. I am giving you the reasons why they go in that direction. One is broken families. Let me complete the answer.
Sure.
B, lack, they want freedom. They want freedom. And they want a kick. Right? All this with a lack of spiritualism, which is now gradually gaining control over a society, is responsible for addictions. What is PGI doing? We run a robust de-addiction center. We have a robust de-addiction center, which is run by a department of psychiatry, and the present head is a de-addiction expert. We have got counselors who counsel these children, and we try and wean them away from these absolutely, catastrophic habits. Not only that, our public health department in our institute is also regularly holding camps and spreading information about addiction and how do we go about.
But clearly not enough.
Obviously, it's not enough, but we're doing a bit. Nothing can be enough in such a monstrous tsunami. I'm using the word monstrous tsunami.
The drug addiction.
Yes, it's a monstrous tsunami. It's not Punjab alone. It's across India. Why? Punjab is because we are next to Punjab. That's right.
Next to
what
Pakistan.
about the other states? It's rampant. It's got something to do with the society. Jyoti ji, it's got something to do with the society. We need to look back. I'm using the word look back at a heritage to realize when spiritualism was there, when we had the right values, addictions were less. Now what is happening? Everyone wants to feel happy. So LSD kick, this kick, that kick, right? That's it. Marijuana, right? Cocaine. Why do youngsters become cocaine snorters? Because they want to look impressive. They succumb to peer pressure. All that would easily be taken care of if A, we had the right values in place, B, the drugs were not available.
And yet, PGI, an institute of excellence, is not working in tandem with the governments of North India to be able to create, if you like, a whole campaign both of awareness and of rehabilitation.
No, that's an ignorant question.
Okay.
I'm glad you asked that ignorant. Oh, yes, we are.
You are working with the government?
Of course. We are running a telemanas facility. That is for mental health. It's running 24/7. Oh, yes. We are doing it.
Okay.
Yes. Jyoti ji, we are doing it. I mean it. I'm on record. Please record me. We are doing it.
Last couple of questions. What is, just to come back to the cancer, I had a question. The Russians have just talked about a cancer vaccine. Do you have a comment on that?
No comments, because until and unless it doesn't stand the test of time, I don't think it's effective. But I am confident a day will come when someday we will have a cancer vaccine. A day will come. It's a little far-fetched to talk about it today, but just a small break and the floodgates will open.
So your research at PGI, you do research,
Yes,
right?
yes.
What is the focus of your research?
So our focus of research is to find out the causes. As I said, we have found out a few things. Liver cancer because of hepatitis, we have seen that. We have done it now in surrounding areas of Punjab, in Abhor. We have given data to the Punjab government that it is rising because of the liver cancer, rising because of alcohol intake, because of viruses. And these are the necessary steps that they have to take, which they are taking. We do that for Haryana, we do that for Himachal, we do that for
So
Jammu
what are the
Kashmir.
5 worst diseases in North India?
So the 5 worst diseases in North India, I would say the worst disease number 1 would be cancer, right, of different kinds. If you ask me which cancer would I really be, which I would pick, I think I would pick up liver cancer because it's directly related to alcohol. I would pick up lung cancer because it's directly related to smoking. That's 2. Then there are childhood cancers which don't have any definite cause other than chromosomal defects. The second thing would be trauma. Third thing is obesity, which is producing diabetes, which is producing coronary artery disease, and which is leading to strokes and kidney failure and hypertension. So these are the 5 commonest diseases. I'll repeat them. So cancer of different kinds, trauma, coronary artery disease, hypertension, kidney disease because of diabetes.
So the people of North India must lead a much more healthy lifestyle going forward into 2025.
We are known for our healthy lifestyle, but of late things are going down an abyss, and this is happening instead of leading from the front. What is happening is we have left children to themselves. I'm using a strong statement. Children have to be guided. You have to tell children the importance of physical activity. You have to tell adolescents the importance of physical activity. You have to tell them sleep in time, get up on time, early to bed and early to rise makes a man healthy, wealthy and wise.
Spoken like a
I
good
look
doctor.
like a dinosaur when I say that, but every word of what I've said is true.
Well, spoken like a good doctor, somebody who's seen what's been happening across this part of the country at least. Dr. Lal, thank you so much for your time. I'm very grateful from all of us here at the Tribune.
And once again, I am grateful to the Tribune for having stood by PGI like a rock. Whenever we have needed help for our convocations, Tribune has always been on the front foot to help us. And Jyoti ji, your questions have been par excellence.
So thank you so
I
much.
hope I passed in my vive voce.
Wish you a very happy 2025 and to all of us watching
my
this show.
patients, I thank them again. I thank my residents. I thank my healthcare professionals, my nurses, my staff. And I hope they continue to do their exemplary work for a good cause.
And to all of you watching this show at the Tribune, we know you read the newspaper. Do also follow us on our social media handles and subscribe to this channel. Happy New Year to everybody.
Thank you.